Okay, so this next series of questions is going to be about insurance coverage for insurance criteria to cover TMS, and we're going to go through each insurance individually. So today's question is going to be, does Medicare cover TMS? All right, so the good news is that yes, Medicare, this is the insurance that is offered, federal insurance that are offered to older patients, 65 and older. It does cover for TMS in every single state in America. Okay, so that's period. Okay, now it differs one state to another for what is the requirement, what is the criteria for somebody to qualify for TMS based on the contractor of such a state. So today I'm going to be talking about Florida, but if you're in a different state, then you need to find the document similar to what I'm going to show you here on the screen and find out exactly for your state what is the criteria for TMS in your state. All right. Okay, so the first criteria is that the patient should have a confirmed diagnosis of severe major depressive disorder. Review one of my videos about what is depression, and then you will see what is MDD, or major depressive disorder. It should be either single or recurrent episode. What does that mean? So depression is a relapse and remittent disease, meaning that some patients will get now diagnosed with depression, and this is their current severe depressive episode, and it did not go away. So this is one single episode. Some patients could actually have a remission from their depression. So depression could last for a couple of months. They get treated for it, they're doing fine, and they move on in their life, and then later on, a couple of years later, they have an event in their life, and then they're depressed again, and they're in a recurrent depressive episode. So that's what this means, single episode or recurrent episode. So it doesn't matter whether it's a single one or a recurrent episode, it's the same treatment as long as it meets number 2 and number 3. So number 2, you need to prove that this is somewhat treatment-resistant episode, okay? Meaning that you have attempted to treat this with other modalities, okay? So the patient needs to meet one of the following criteria. So there are 4 criteria in here. You need to meet one of them to prove that this is the level of TMS. Now, number 1, which is the most common one that we use, is failure of 4 trials of antidepressants. So the patient should have tried 4 antidepressants medications in the past. And those antidepressant medications should be from at least 2 different agent classes. For example, if a patient was tried on Prozac, Zoloft, Paxil, Lexapro, those are 4 medications, but they're all from one class of medications, which is SSRIs, right? So we need patients to have tried 4 antidepressants from at least 2 classes of medications. So let's say somebody had tried Zoloft, Prozac, Paxil, and Effexor, right? Because Effexor is an SNRI, serotonin norepinephrine reuptake inhibitor, then they actually meet the criteria of 4 medications from 2 different classes, okay? All right, and at least one of the treatment trial must have been administered as an adequate course of mono or polydrug therapy, antidepressants involving standard therapeutic dose, at least for 4 weeks duration. So sometimes when you prescribe an antidepressant, a patient might not continue the treatment, whether this is because of side effects or non-compliance because they're depressed, they could not remember to take their medications and what have you. Here it's saying that at least one of these medications should have been at a therapeutic dose, meaning that we increase the dose to what's appropriate, and the patient had taken it for at least 4 weeks. Or, this is number 2, inability to tolerate psychopharmacological agents, as evidenced by 4 trials of antidepressants with distinct side effects, meaning that, let's say we gave Zoloft to somebody and they had profound diarrhea that caused dehydration, they needed rehydration, this is severe side effects. It's different than if somebody had a little bit of groggy stomach when we started Zoloft, because that would usually go away after a couple of weeks. Somebody had distinct side effect that was severe enough to stop the medication, or for example somebody was started on Prozac and they have sexual side effects and it's affecting their life with their spouse. This is a big deal, right? And that's a reason to stop the medication. But you need distinct side effects that indicate the discontinuation of the symptoms. So that's also 4 trials of medications, and we're going to comment on that later on, because this is a lot of trials of medicines. Why are we pushing away or pushing back treatments for depression all the way back there? All right, so another way to approve somebody for treatment resistant depression for TMS is that if they had a response in the past. We talked about that in a couple of questions that we answered about retreatments. So if somebody had TMS in the past and they responded to it, meaning that they had 50% improvement of their symptoms based on some rating scales, when patients will answer some questions with numbers, so they can qualify for TMS again. Number 4 is that if the patient is currently receiving ECT or ECT was recommended and then TMS is less invasive treatment and it's an option for the patient. So basically, if somebody is now being referred for ECT and they stumbled across TMS and they were like, you know what, let me ask the doctor if TMS is also okay. The answer is yes, it's okay. Then you don't need to be on 4 medications. If you were already referred for ECT or you're going through ECT and you haven't tried 4 medications, only 2 medications, then you could qualify for TMS. All right. And then the third thing that needs to be met, so you need one of those 4, okay? You definitely have to have the diagnosis of MDD, but also you should have had tried evidence-based psychotherapy known to be effective in the treatment of MDD. Now, they did not specify what type of psychotherapy, and they did not specify the duration of the psychotherapy because could change over time. Currently, cognitive behavioral therapy seems to be the gold standard. Interpersonal therapy is another treatment option that is evidence-based. Dialectical behavioral therapy does help with depression, and there is evidence behind it. They vary in their duration of how many sessions. But if we're talking about cognitive behavioral therapy, it's commonly accepted, to kind of expect patients to attend 12 treatment sessions of cognitive behavioral therapy to be considered adequate psychotherapy trial. Okay, so the bottom line in here is that patients should have MDD diagnosis, whether a single episode meaning only 1 episode or recurrent depressive episode. Patient should have tried 4 antidepressants in the past or had side effects to 4 antidepressants in the past. They must be from 2 classes of medications, meaning that we have attempted to try different classes of medicines to see if the patient would respond to that or not. Patient could qualify for TMS if they had TMS before and they had a good response to the treatment, and patient could qualify for TMS if we're considering ECT for them. Under all of these conditions, patients should have tried psychotherapy first before we consider them for TMS. All right, so as you can see, this is a very hard to meet criteria from Medicare. The good news is here in Florida, soon there is a new LCD, local coverage determination policy, that is going to come up that has a significantly more patient-friendly criteria. So then the new criteria would say failure of 1 antidepressant, which is in compliance with the FDA criteria for TMS. So that is going to be helpful for a lot of people that had been denied TMS in the past. Now they would have access to TMS. So that's good news. The other thing is that Florida used to be the worst. Hopefully once they change that criteria, to the 1 failure of medications, we will be among the best, among the states. But all other states have either better or significantly better criteria than this. So classically, most states will have failure of 2 antidepressants rather than 4 antidepressants, which is significantly better because we want to help patients earlier, because the more treatment resistant somebody is, the less likely they would respond to the next attempt of treatment that they would have. All right, so I hope that this is helpful. 4 failures of antidepressants or intolerance of 4 medications, having response to TMS before could help as well. Definitely patients should have tried psychotherapy first. All right, thank you. Disclaimer. Although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.